So just to go over some quick demonstration techniques while we're using this, and certainly when we are demonstrating this to our offices, reminding our offices that we do carry the full laser line of our perioptics. So you can simply take this plastic piece off and replace it with the laser shield. Very quick, very easy to do, and it renders them to be able to use their perioptics lupus as well. So not to forget that, because that's very important, so that we're not switching and putting different things, taking things on and off our face and breaking a sepsis. So just for the sake of demonstration, let me just show you a quick technique and how we're going to initiate the tip. I have it on cutting mode right now. As you can see, this is highlighted. It's at a 1.2 setting. It also says that it's ready to go. So what most offices will turn it on, they will make their selection, they will hit the enter button. Now they're ready to go, but for whatever reason the laser doesn't cut. Oftentimes we find out it's because they haven't initiated the tip. So initiating it is very important before we begin. So we're just going to simply start by, and you will get some smoke and you will get that tip to initiate quite quickly, just like that. As an operator, as far as a dentist assistant's perspective, as your assistant is wiping the tip and removing any sort of extraneous tissue that may or may not be on the tip, sometimes you can wipe off some of that. So if you find that your tip isn't cutting as effectively as it did when you first started the procedure, you might want to just behind the patient's head, take just a second and just reinitiate the tip, just to make sure that we always have that optimum use. But I'm going to show you some laser techniques just on here, but you can certainly watch our Chris Owens video and to understand how we're going to demo this. With this, I'm just simply using a household orange, just a straightforward orange, and I've drawn some shapes on here just so that you can see following the shapes, so what this stroke is, the brush stroke that we're going to use. And we're going to put our fulcrum finger, our ring finger of our dominant hand is going to rest on whatever it is I'm cutting. We're going to use a modified pen grasp, which means hold it like a pen, just like that, and a light grip motion. We're going to use a feather type stroke for it. So as you can see on here, being able to cut through this. And certainly you can see the plume that tells you that you are cutting this as well, but overlapping, light feather-like strokes that are overlapping to be able to create our margins or whatever it is that we're using it on. And certainly it tells us that we are cutting, and that glass fiber will do all of the work for you. So a nice feather-like stroke. When we want to show being able to use this for anteriors, we can certainly angle it at a 45-degree angle just to sort of remove some of that tissue that's on there. Keeping this constantly in motion is going to give you a nice, steady cut to it. And as you can see, we've gone down to the layer of the skin, and now we're at the fruit. So very quick, very easy to use, but a light overlapping feather-like stroke, and also be able to fulcrum or steady your hand, either your ring finger or your pinky finger, being able to use either or to support your hand when you're showing a doctor or a hygienist how to use this. So it is effective. When they're in the mouth, certainly they are going to use a fulcrum as well, just being in control of that instrument at all times while we're doing this demonstration for the doctor.